So if you've ever dealt with back pain before, you know how it can pretty much affect you both mentally and physically.
So what can you do to make sure the rest of your summer isn't spent on the couch? We have certified spine surgeon Dr. Hamid Abbasi here today to help us understand more about our backs. Doctor, thanks for being here today.
It's a pleasure to be with you, Heather.
Yeah.
Most of the time, people think it's a sport injury that causes a problem. But in my practice, 9 out of 10 times, it's just the lifestyle, the sedentary lifestyle that causes spine injury. And what I mean with that our spine is the most complex machine for what I consider in the biology, and it requires certain level of activity, and we sort of limit our activities 99% of the time to one thing, and then the moment comes that you want to impress your son on a roller coaster, and then all of a sudden you go way above that. So start it slow. If anything you want to do, start slow, slowly go up, and listen to your body. And if your body gives you discomfort, the next level pain, just listen to that and don't try to
go on the roller coaster if you haven't done for 20 years, or to water ski, but if you want to try, you know, paddle boarding or something, that might be different. So you talked about a sedentary lifestyle. Give us some examples of what you mean besides just sitting at our computer all day or sitting in a chair.
I can tell you about my lifestyle. As a spine surgeon, I'm not immune to back problem. Most of the time, I'm standing up doing surgery, but in one position. And the rest of the time, I'm doing documentation, sitting again on a chair. I'm doing that. It is not like an active kind of lifestyle that changed my position, put my joint to the maximum stress for a very short period of time, and then slowly we increase that. That would be a healthy lifestyle. It is just a few positions that I have to be in for my entire day, and then all of a sudden I want to do something more than that, and that becomes over what my spine is ready to take.
Do you recommend breaks then in your day, or do you recommend one long walk at the end of the day, or shorter walks throughout the day?
My best advice to anybody is who has been in this kind of lifestyle: start short walks. Get a dog. That is why people with dogs live 7 years longer, because it forces you to have these walks. And I'm not talking about jogging or marathon and so on. I'm talking about just actively putting your spine to good use. And what I notice myself is that small stretches, Pilates, yoga.
You started yoga, right?
Yes.
And that's been helped. Even 10 minutes?
10 minutes, but you have to be consistent. You see,
that's the key?
You have to be consistent, and you have to build it in your lifestyle. You cannot just, do, when you have pain, do 10-minute yoga, stop for 3 weeks, and then do another 10 minutes when you have pain
That'd probably be worth. Now, money bags over here has got a big wallet.
Ain't no money bags over here.
Money bags over here has a big wallet.
Is this a good idea?
Oh, that's a huge wallet. I would keep it somewhere else.
Don't take my money.
So don't put that in your back pocket. That's not good for you.
And that's what it does. It changes the anatomy of your pelvis. And we know now that anatomy of the pelvis affect the anatomy of the spine. Yes,
It makes so much sense.
And especially we drive hours and hours. We were talking about that, and you're sitting on that thing and you don't notice it. Your spine is compensating by changing your spine to the different direction. Your hip is pushing up, your spine changing the other way. A little is fine, but you're not doing a little.
Let me tell you what, too.
You're not, and then you got to go see Dr. Abbasi.
And not only that, but that half-hour commute, now it's too long. It's way too long.
Doctor, thank you so much for being with us today. It's been great.
Thank you very much. I really appreciate that.